Welcome back to Heart of Health. We just finished answering a question from a lady in Idaho, and I hope she's watching today and becomes personally involved. Art, it is important that we become personally involved, not only in our health care, but in everything. You know, we just, as a society, you know, we're just not getting involved and being active, and that's what our great country was made for. We look back at our backdrops, the administration of justice. Our country was made for people to become involved, and our forefathers, they got after it. And sometimes now we let the media just numb us.
Absolutely. We have to be involved, whether it's healthcare on a healthcare personal basis, healthcare on a legislative basis. What's going on in our local communities, what's going on in Washington, what's going on in the state capitol, all of those things, we have to be involved. If not, we're going to keep getting what we've been getting.
Right.
If they don't hear from us, if our legislators, our governors, senators, even the White House, if they don't hear from us, they're like, well, we're on the right track here. We need to say sometimes, hey, you're not on the right track. Take the responsibility, step up, make your position known.
Okay. You know, I think this next question is going to help someone and probably has more to do with a benefit board question, which you have experience in. So I think you're qualified to handle this one. This question comes from the state of Indiana. It says, my husband was a pastor and has passed away. I'm 76 now. How can I know his retirement funds will see me through? I mean, I don't know. I mean, that's a tough question. But is there any sort of general recommendations you can get in widows that are in this situation that are worried, concerned about different financial issues? How would you deal with this?
You know, Dr. Marcum, the issue that we always deal with every day, and we serve right now somewhere around 5,200 participants. We manage $260+ million. And the biggest question that we have from retirees when they're going into that retirement stage is, will my money outlast me?
Right.
You know, they don't want to die before their money runs out.
Right. Well, that's reasonable.
That's reasonable.
What do you do?
And we're all in that same boat. You know, it's kind of like that. Do you have more month or money at the end of each month? So generally, for a lot of us, we have more month than we have money. And I think that's the gist of our question here. I think the things that a person needs to realize is that their cost as they get older will actually decrease for their daily living costs. The only thing that truly goes up is their health care costs.
Right.
Health care costs continue to rise, but you know, you take a 65-year-old, they're going to do a lot of traveling when they retire. When you're 78, 80, 85, your traveling is cut back just from the pure circumstances of things. So what this person should be concentrating on is making sure, look at what their long-term life expectancy is. The best way to do that, as you well know, is forget all the charts that the IRS tell you how long you're going to live. Think about how long parents have lived, how long older siblings have lived. If they've lived to be 90, good chance you're going to live to be 90. But if they all died at 78, you may be living on borrowed time here, you know. So take that as the first step and say, okay, I've got X number of dollars and my projected lifespan is another 10 years. How can I best pull that down over that period of time and utilize those things? And what most people think about is they say, we got all this money in the bank, that's what I've got to live on. And they forget that their home generally is a huge pile of equity. There's wonderful products now, reverse mortgages, if done properly, can be a great source of income for people in the latter years of their life. It's not for everybody, but it is an opportunity that they can use to pull equity out. So most people are not going to have that challenge, particularly with the assistance that they get from Medicare.
Well, good. And also I'd like to add, you know, you talked about the health care cost. Again, the thing that helped elderly most, exercise, drinking water, having some good health habits, getting enough rest, those things will also help in our long-term care expenses. We have another question that's going to come up after this break about an HSA count. I want to recommend that you continue to stay with us as we learn all sorts of things from Art Rhodes. Don't go away. We'll be right back. I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine.
You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
Hi, I'm Dr. James Marcum with your Daily Heartbeat. I have a saying I like to say, and it's this: it's at the heart of healing is love. Now, what would that mean, and what would that have to be with healing? But did you know that love is a way that we can change our body's chemistry? There's been studies done that show people that have animals, which could include a dog or a cat, if they have them, they actually have less heart attacks, less stroke, less infectious diseases, and even less malignancy. Well, do you think it's anything about these animals yelping and barking and meowing that changes the chemistry? No, it's not. It's the love that's shown between owner and manual. Likewise, we know that people that are happily married, if one of the spouse should suddenly die or get sick, that there's a greater likelihood of the other spouse developing a disease. So at the heart of healing is love. And love is one of the most valuable treatments we have to stay healthy. In the last segment, we were answering a question about a poor lady that was concerned about her funds lasting, the rest of her life. And again, it comes back to if healthcare is, the things that she can control expense-wise is her healthcare expenses. And just by a few things like walking, eating good foods, routine maintenance, she can really take good care of herself. And it only makes sense to me that as we have more health problems, we should start getting more back to the biblical plan where we prevent the problems rather than have to slap a Band-Aid on all this. And we should start promoting that, promoting good health, not only in television and in media, but at every different aspect.
No question about that, and spending more doesn't often provide better health care. In this country, we spend better than $7,000 per person on health care cost a year, just outright cost. That the next highest industrial nation only spends $3,200.
Wow.
But we rank 19th in the industrialized nations in the quality of our health care. Yeah. We've got a great health care process. We just don't have a great healthcare system to take care and to encourage that preventative care that you're talking about.
Yeah, and we hear about this on this program of people needing acute care medicine, and that doesn't really fix any of the problems. That just deals with the acute care problem. But what do you think is the answer? We're spending more money and not getting a bargain. What is the answer to this? Where can we go is it, how do you legislate personal responsibility?
Well, we spend better than $2 trillion a year. 17% of our GDP is spent, our gross domestic product. Of all the spending in this country, 17% or 1/6 of it is spent on health care. And again, it is a lot of times we're wasting tests, we're going to the doctor, going to the emergency room when we've got a headache and we should be going to some outpatient clinic. And I think it's very hard to legislate that, to say, hey, you can't go to the emergency room, you need to go to this health care clinic.
When I started medicine years ago, though, one of the things that we see in medicine is that people want tests. Doctors order tests because they're afraid if they miss something, the patient's going to come around and sue them. So, I'm hoping that from my standpoint that we can have that relationship between doctor and patient that's been lost now. We're scared. There's a middleman, and that middleman, the insurance and people afraid of suing, it's all sort of a symptom of a sick society. Where's that trust and love that people used to have for their fellow man?
Yeah, we've heard a lot about tort reform, which is that suing for issues that come up. And again, it's back, if I go to you and say, Doc, I'm having this problem, and I go out there and a week later I'm still having this problem, it doesn't mean that you caused it.
Right.
But that's the way we look at it. It's generally a simple way to, let's try to solve this problem in an easy way, and it's just not easily done. It's back to, again, that personal responsibility.
Right.
If we don't take personal responsibility for our own care, then we're going to seek some type of easy way out.
Yeah, and I think providers and patients, we need to have that relationship, that relationship where we trust each other and we care for each other. We get back to what I say is at the heart of health is love.
Right.
We have one quick question here as we close. It says, I have an HSA account. I'm worried that this will be eliminated. Is this true?
Health savings accounts basically allow you to accumulate tax-free money to be used to provide for your health care, to cover things that maybe your insurance does not cover. They are wonderful, and they should not only not be eliminated, they should be encouraged. Okay. Now you can only have an HSA if you have a high deductible health care plan. But what we need to do is say, from a legislative standpoint, we need to say everybody should be entitled to an HSA, so you can set aside money to cover eye care, other types of things, buying eyeglasses, contact lens, those things, even dental care that's maybe not be covered under your policy. We should be encouraging that rather than trying to limit it.
So we don't know if it's going to be eliminated next.
Do not know. There's been all kind of discussions.
Okay, good. Well, this has been fascinating. I know it's more than we can go in a short period of time, but I want people to think of it. If there's one thing that I want to stress above everything, it's personal responsibility.
Absolutely.
And if you might have questions where we can help you become personally involved, go to our website, heartwiseministries.org. We'd be happy to answer your questions. Until next time, think about becoming personally involved today.